Hi everyone, I'm Dr. Roman and I'm a blood and cancer specialist, and today we're going to talk about vaccines in an immunocompromised patient. So if you're a person, for example, with cancer, or you have a connective tissue disorder like lupus, scleroderma, psoriasis, there's many of them out there, or a neurological condition like multiple sclerosis, especially if you're on treatment like chemotherapy or biological agents, then this talk is pertinent to you. We're going to go over a lot of information. And I'm going to ask you one thing. If you find use to this video, if you learn something, please subscribe, like, and share with somebody that you believe may also derive some benefit. So I'm going to ask you to read my medical disclaimer. Remember, I'm not your physician. I don't know the details of your case. So this video is for educational purposes only. I am not providing any specific medical advice. All right, so if you're deciding on a vaccine or not, the first thing you have to do is to sit down with your physician and discuss what are the pros and what are the cons of receiving a certain vaccine. But there are some basic concepts that I want you to know about certain vaccines that may help you decide if it's the right time or when should you receive the vaccine, especially if you are immunocompromised. Now, as an example here, caution with live vaccines. We're going to go into this in a lot more detail, and that's the reason I want to present this video to you now. So if you're a cancer patient, just know that in general, we divide cancer into two types, and that's hematological cancers or blood cancers and solid tumors like breast cancer, colon cancer, lung cancer, breast cancer. The hematological cancers include leukemia, lymphoma, and multiple myeloma. And just know, as a general rule of thumb, hematological cancers tend to cause more immunosuppression than do solid tumor cancers. Now, if you are on chemotherapy for either one, then obviously you will also be immunocompromised. So I thought that it's important that if you have one of these liquid tumors, the leukemia, lymphoma, and myeloma, you're likely at a higher risk of being immunocompromised. Now, vaccines, and this is very important and you really need to pay attention here. Vaccines in general are divided into two types: live attenuated vaccines or dead inactivated vaccines. So as the name implies or says, live vaccines are a virus or a bacteria that is alive, but its strength has been decreased. So it's not so virulent or so aggressive. So when we give you this virus or this bacteria, it is alive, but your body should develop immunity towards it, and little by little, it'll kill it off as your immune system increases. The problem with this is that if you are immunocompromised, if you are on biologics or on chemotherapy, then your immune response is not good. You're not going to mount that immune response. So that virus or that bacteria, which has been weakened, might cause disease in your case because, again, you don't have a good immune system. So that's why, in general, if you are immunocompromised, you have to have a lot of care or caution with live vaccines. And we're going to go over that in more detail. Whereas the dead vaccines or the inactivated vaccines, you're basically receiving a virus or a bacteria that is dead, or you're receiving a piece of it or a fragment of a virus or a bacteria. So it's unable to replicate and grow. So basically, when your body receives this piece of virus or piece of bacteria, then your body will develop immunity towards it. And that's why we call these dead vaccines. Now, the other thing that I want you to know is that if you are immunocompromised for whatever reason, whether you have cancer and you're on chemotherapy or any entity that can cause immune suppression, whatever vaccine you receive, your body is not going to mount a good immune response. So even though you're vaccinated, you may not be completely protected the way that a person who has who's immunocompetent or has a normal immune system would develop immunity towards that vaccine. So that's something you always have to keep in mind, and that's why it's so important as far as choosing the timing as to when you should receive a certain vaccine. Now, this leads us to our next topic, which is the timing, or when should you be vaccinated. Now, in general, if you have a normal immune system, then in general, you can be vaccinated whenever you want. But remember, this is for immunocompromised patients. So if you're a cancer patient, for example, if we have time, we would like for you to receive a dead vaccine at least 2 weeks or more before you start chemotherapy. And if you're going to receive a live vaccine, we would like for you to receive that live vaccine at least 4 weeks or more before you start chemotherapy. Now, this applies to any condition that may decrease your immune system. So if you have lupus or scleroderma or multiple sclerosis, and they're going to start you on an immunosuppressive treatment regimen, then the same guidelines tend to apply to you. So very important for you to keep in mind. Remember, in general, it takes about 2 to 3 weeks for your body, once you receive a vaccine, for your body to start producing immunity. So 2 weeks is about the bare minimum. After that, your body's already making antibodies or immunity. Now, do not, as a general rule, do not receive a live vaccine if you are immunocompromised. That's important because think about it. As we already mentioned, your immune system is not working appropriately, and you are going to receive a vaccine with a virus or a bacteria that is alive. And although it's been severely weakened, it can still replicate and grow in your body and go unchecked because you don't have a good immune system. So you should really avoid these live vaccines if at all possible. Whereas you can, in general, receive a dead vaccine, but the problem that I'm putting here, try to avoid it, is because if you are on chemotherapy or you are on any type of immunosuppressive treatment, then imagine your body is not going to mount a good immune response to that vaccine. So yes, it might mount some degree of immunity, but it's not going to be, for the most part, it's not going to be that robust immune response. So it may also give you a sense of false hope because you think you're vaccinated and you think you're okay, but you may not have immunity to whatever it is that you received the vaccine for. So that's why it's so important that you keep this in mind. And it's not that you cannot receive it, but try to avoid it if you can. Now, as a general rule, just know that even if you are immunocompromised, most entities state that it is okay for you to receive the COVID vaccine or the flu vaccine, even if you are immunocompromised. Now, again, you may not develop that robust, good immune response, but in this case, especially something that's highly contagious, like the COVID virus or the flu virus, that's why they still recommend that you should receive your vaccines, even if you are immunocompromised. But remember, ask your physician. Now, how long do you need to wait after you have completed chemotherapy or any type of immunosuppressive treatment? And there's two things here you have to look at. The first thing is, did you receive an anti-B cell treatment? Okay, remember, our B cells, which is one of our white cells, our B cells provide or make immunity. It makes our antibodies. So if you received a treatment that will severely affect your B cells, then it's going to take a lot longer for your body to make immunity. So medications like rituximab or alemtuzumab, there's a bunch of them out there. You just want to ask your doctor, did you receive an anti-B cell treatment? And also, if you received a chemotherapy that is highly immunosuppressive and may cause prolonged immune suppression. Now, most chemotherapies do give some degree of immune suppression, but there are some chemotherapy agents like fludarabine, which causes prolonged immune suppression. And you need to know this. So ask your doctor, did you receive one of these chemotherapies that can cause prolonged immune suppression like fludarabine? And if the answer is no to both of these, then after 3 months, you can receive, as a general rule, both dead and live vaccines. Now, if you did receive an anti-B cell treatment, or you did receive a highly or chemotherapy that causes prolonged immune suppression, then you should really wait a minimum of 6 months. And then after this 6-month mark, you can receive both live and dead vaccines. All right, now to conclude, we're going to go over a list of dead vaccines and also a list of live vaccines so you know which one is which. So starting off with the inactivated dead vaccines, the COVID vaccine, it's not really a dead vaccine. For the most part, they are mRNA vaccines, but I just threw it in here because it's not a live vaccine. So just consider it as a dead vaccine. The flu vaccine is a dead vaccine for the most part, and there's one exception which we will go over on the live section. But the regular flu shot is, for the most part, a dead vaccine, as are the meningococcal, the pneumococcal, and the Haemophilus influenza type B. Now, these three are bacteria. They are encapsulated bacteria, and we have vaccines against all three. Now, the important thing here is, if you are missing a spleen, you should strongly consider receiving your vaccines against all three, the pneumovax, the meningococcal, and the Haemophilus influenza type B, also called the Hib vaccine, because you are at high risk of acquiring one of these infections. The tetanus, diphtheria, and the pertussis, also called the DPT, or a combination of these, for example, the TD or the Tdap, these are dead vaccines. The hepatitis B and hepatitis A are also dead vaccines, as is the HPV vaccine. Remember, the HPV virus has been linked, it's a sexually transmitted disease, and it's been linked to cancer of the throat or the tongue, the head and neck region, the cervix, and the anal region, and we do have a vaccine. So, just want you to know that it is a dead vaccine. As is the RSV vaccine, which it's a virus which causes respiratory tract infections. We do have a vaccine, and it is a dead vaccine. Now, polio has a live one and a dead one. Just know that the inactivated polio vaccine, as long as it says inactivated or dead polio, of course, is a dead vaccine. And the zoster recombinant non-live vaccine, also called the Shingrix, is a dead vaccine. Remember that zoster is what causes shingles. So this vaccine is a dead vaccine. Now, moving on to the attenuated or live vaccines. Remember, these are the ones that the virus is live. It's just not as strong, so you need to be careful if you are immune compromised and avoid them. Do not receive these vaccines. The first one is the MMR, which is the measles, mumps, and rubella, which is usually given to children. So measles, mumps, rubella, or any combination of these are live vaccines. That's usually the big one. The varicella, the cause of chickenpox, is also a live vaccine. The BCG vaccine, which is used mainly in other countries against tuberculosis, is a live vaccine. There is a flu vaccine, which is an intranasal type vaccine. And just know that the intranasal flu is live. Adenovirus is a live vaccine, as is the dengue tetravalent. The polio vaccine, that is live. Remember, there's a dead one and a live one, so make sure that, for me, I would make sure I'm receiving the dead polio vaccine. As is the typhoid oral vaccine, the rotavirus oral vaccine, the smallpox vaccine, and the yellow fever vaccine are both live vaccines. And there is also a live zoster vaccine. Now, the live zoster vaccine, to my knowledge, is no longer available in the United States, but it is available in several other countries. So make sure if you're going to receive the shingles vaccine or the zoster vaccine, make sure you know which one you are receiving. So that's it. I hope that you found this video helpful. If you did, like, subscribe, and share, and I'll see you on the next video.